Hello, welcome to Life Matters. I'm your host, Brendan O'Connell. Well, today's topic is one that is interest for many people, particularly those couples that have difficulty conceiving a child and really do want a child. And the issue often sends people into in vitro fertilization clinics that, their success rate isn't that terrific. And today we have someone who has an alternative method that has had much higher success rates. He's driven in from central Massachusetts or western Massachusetts to be on our show today. We're very grateful for that. He graduated from Assumption College in 1982, where he was a magna cum laude student, and also he graduated in 1986 from St. Louis University Medical School, where he had high honors in ethics and high-risk medicine, particularly, I believe, with pregnancies. We welcome Dr. Paul Carpentier.
Great. Thanks, Brendan.
Nice to have you.
Thank
you. Can you give us a little bit of understanding of the whole infertility issue? Why is it that couples are infertile, and what is being done about it?
Well, it's a very heartbreaking issue, of course, for both the man and the woman, and unfortunately it's very common. 25% of couples thereabouts are having trouble achieving pregnancies. And if you look at just the people that are over 30, which unfortunately many people are, the infertility rates are 33%. So 1 out of 3 couples is having a great deal of trouble achieving pregnancy. And it's heartbreaking. It goes to the core, their dreams, their futures that they had envisioned. And so these people are turning to the medical systems for help, of course. And whether it's their primary care doctor, their family doctor, or their obstetrician, there's usually a cursory evaluation, if anything, and then the current trend is to send them off to the In Vitro Fertilization Center. Mm-hmm. But doctors are supposed to look at the underlying causes of the things, and the In Vitro Fertilization Centers, both from a medical, technological point of view, aren't looking for the causes, and as reported by the patients that come to me, I asked them what kind of evaluation was done, and the answer is nothing. And I said, what did they say was the reason you couldn't achieve a pregnancy? And they said they didn't say. They just said, don't worry, we'll get you pregnant. And many people in our country, many doctors in our country and across the world are saying, that's not really good medicine. You know, if someone had some fluid in their legs and the doctor just said, oh, here's some water pills, you didn't find out what's the underlying reason for that fluid in your legs. So medical care, when it comes to infertility and many things in gynecology, is heading off on a path of symptom relief instead of exploring the underlying causes. And it turns out that if you explore the underlying causes, then we become very, very successful. You're getting down to the root causes, and it's healthier for the pregnancy, meaning the baby, less chance of premature birth, which is a wonderful thing because otherwise the baby's going to end up in the neonatal intensive care unit. And it's better for the woman's health going forward because you've uncovered what led to that infertility. That same process could also lead to other problems down the road, such as ovarian cysts, maybe a higher chance of endometrial cancer, maybe a higher chance even of breast cancer. So you really want to dig down in and figure out what's wrong.
And so it's my understanding that in vitro fertilization, they run a couple of tests, 2 or 3 tests, and say, okay, you're a candidate. There must be a great financial incentive for the in vitro fertilization people to do these sorts of things. And also, what about the number of embryos they create in vitro fertilization?
The embryo issue is a very important issue, morally and ethically. Financially speaking, to answer your first question, basically they're charging about $15,000 per menstrual cycle, so that's per month. There are many drugs that aren't covered by insurances. Thankfully for couples in Massachusetts, the medications for the most part are covered, I believe, and the procedures and the laboratory issues are covered by state mandate. But in many parts of the country, it's not so. And so the couples need to come up with $15,000 before they even are evaluated. The evaluation is cursory. The things that are done to the woman, the medications, drugs, hormones that are given are oftentimes very strong and encouraging the ovary to do things that it doesn't naturally do, such as ovulate with 8 or more eggs in one cycle. And then they will go into her body with needles guided by ultrasound into these little follicles, which are cysts on the ovary. Each follicle has an egg inside, and they'll put the needle down into that follicle, retrieving the egg, then having harvested some sperm from either husband, other partner, or other men that have donated to a sperm bank, they will join the sperm and the egg, and they're hoping for several embryos.
And that would be in a Petri dish?
In a Petri dish, external to the woman's body, in glass, therefore the name In Vitro Fertilization. Fertilization in glass, as opposed to in the woman's body, which would be in vivo. Mm-hmm. So it's outside of the woman's body that the fertilization is taking place. And the Catholic Church, Catholic teachings, and many other religions believe, and science points to, that is the beginning of human life. So now you have this woman and the man have 8 children or more in this Petri dish. And so then they have to explore, well, I can't put all 8 into my body, that would be very dangerous. Thus the Octomom in California, she said, I want you to put all 8 in, I'm responsible for all of those, I want you to put all 8 in. And the doctor who did that has now lost his license because he put her at such great jeopardy. Mm-hmm. So a discussion then takes place with the parents and says, okay, well, how many of these would you like to put in to your body, and hope that they would take. And that process unfolds according to the mom's direction, but then they would also say, well, what do we do with the others? Do we freeze them, discard them, donate them to science, make use of them? And that's a very heart-wrenching decision for the couples to make. The embryos that they put inside the body, you're hoping that they will attach to the lining of the womb and start to grow. Sometimes they do, and oftentimes they don't. So then she's losing those embryos as well that don't take. If there are more than 2 babies developing inside the womb, then another harsh decision is made that it's very dangerous for mom to carry triplets or more. Mm-hmm. And so they will offer to go in and destroy one of those pregnancies, one of those babies.
And what is that called, Liz?
A selective reduction.
Selective reduction, which is a fancy word for an abortion, basically.
Destroying one of the babies that are growing. In the process of doing that, there is some risk to the other babies as well. Therefore, there's much pressure on the parents to choose to only put 2 embryos at most into the womb. And in other states where the couples are paying this money for the procedure, they feel the financial pressure to say, well, let's put 3, maybe 4, hoping that it will take because it cost me $15,000 to get to this point. Mm-hmm. And so in other states, they're running into many more triplets and quadruplets than we tend to have in Massachusetts. And Massachusetts is being studied, and it's starting to be the trend, the standard of care in the IVF world, to say we can only put 2 at most. And that becomes more of a financial hardship on the couples in other states. It becomes an insurance hardship for the third-party payers here in Massachusetts.
Mm. Well, what about, then how is NAPRO technology? What is NAPRO technology, and how is it different than in vitro fertilization?
So NAPRO technology is sort of a combining of 3 words, Natural Procreative Technology. And basically it says that we're trying to heal the woman's body so that she can achieve a pregnancy, procreation. And the technologies that we use are standard medical treatments that are available, that similar to some of the things they might do in the IVF centers, but guided in a way that helps to heal her body and helps it to function well. So NAPRO technology, otherwise known worldwide as restorative reproductive medicine, is looking at the underlying causes and trying to fix it. Just like if somebody had fluid in their legs and you find out that, oh, you have a leaky heart valve, let's try to fix that leaky heart valve. So we're fixing the underlying process. What are these processes that we encounter? Oftentimes it could be a low sperm count. It could be in the male's body. And so we have ways to help the sperm counts to be better. We have the ways to help the sperm motility to be better. And if it is a male low sperm count issue, also helping the woman's body to work better, namely improving cervical fluid that helps to support those sperm on their path through the womb or up to the womb and the fallopian tubes. Making the cervical fluid to be better is one of the best things that you can do for low sperm counts. And we have ways to accomplish that too, very simple ways. Sometimes even just the common medication amoxicillin is very, very good at helping the cervical fluid to be better. And then even if the sperm count remains low, sometimes on the order of just a couple 100,000 sperm, normal is more than 20 million, but just a couple 100,000 sperm, if you've improved the cervical fluid, the ovary is working well, they've achieved a pregnancy. Something as simple as $5 of amoxicillin.
Wow. And what about the ovaries working well? Why is that important? Or do ovaries not work as well, or they malfunction? Or can you talk a little bit about that?
Definitely. Ovary dysfunction is one of the leading causes of infertility. And there are many things that impact the ovary function. It's a cause of much research these days, looking into what it might be. Of course, the birth control pill works by trying to shut off the ovary. And then once a woman has shut off the ovary, whether it's the birth control pill, Depo-Provera, Norplant, whatever it might be, then how likely is it that the ovary starts working well again? Typically it does, but it might take 3 to 6 months to accomplish that. But then the cervical fluid has been actually quite suppressed, and this isn't talked about by the doctors that are prescribing these birth control pills and the like, that the cervical fluid does not recover. It's like advancing the aging of the cervix so that it cannot respond to the messages from the ovary that it's time to make cervical fluid. And so it might be that the ovary is actually working well, she's releasing an egg, the sperm are present, but they can't get to the womb because there's no cervical fluid. It's like a desert, and the sperm will die within 2 to 3 hours.
So the fluid actually helps both the sperm and the egg, once they unite, to travel, up the fallopian tubes?
That's right.
To the lining of the womb.
That's right. The sperm need to make it to the outer third of the fallopian tube where conception will take place. Then the embryo, in its first stages of development, is actually happening in the fallopian tube, needing to reach out to mom's lining of the uterus by day 8 of the life of the embryo. Needs to implant, get some oxygen from mom, some protein, some fluid, and so on. That implantation has to happen around about day 8 of the embryo's life. So back to the IVF centers, they know that, and they'll try to be putting the embryos in around about day 8. What they do between day 1 and day 8 can vary depending on the choice of the mother and maybe research that's going on, but they might say, all right, let's see if this embryo carries cystic fibrosis. Let's see if this embryo is a male or a female. They can do these kind of studies by stealing a cell or two from the embryo. It only has about 16 or 32 at this stage, but you steal 1 or 2, do some genetic studies and find out male, female, cystic fibrosis, no cystic fibrosis.
How about Down syndrome?
Down syndrome, yes.
And endometriosis, what's that word again?
Yes.
What is that? That's another problem.
Endometriosis is another thing that's very common. About 80% of the people with infertility will have endometriosis being a factor in their diagnosis. So it's very common, 80% of infertility couples. Now that doesn't mean that everybody with endometriosis will have infertility, but it's about 2 to 3 times as likely to have infertility if you have endometriosis. So now we said it's about 25% likely in the general population. If you 2 times that, now you're 50% likely to have infertility if you have endometriosis. So back when the person is younger, say between 15 and 25, if there is endometriosis, there's some research going on to say if we get rid of that, will that preserve her fertility? And the early studies are, it looks like it is preserving her fertility down the road.
And what about low progesterone?
So when someone has endometriosis, or if the ovary for other reasons isn't working well, the ovary is not making adequate amounts of estrogen and progesterone. If we give estrogen, that's a little bit more dangerous, things like breast cancer and maybe even toning down the function of the ovary. So you don't really want to give people estrogen. But once you get into the second phase of the woman's menstrual cycle, after ovulation, that progesterone is very important. It's a very safe thing to give people. It helps the lining of the uterus to be ready to receive the new human life. There's all kinds of glands and blood vessels to feed the baby because of the progesterone. And so very often, we naprotechnology doctors are giving the moms progesterone timed at the right part of her cycle.
I see. And what about other abnormalities in the womb that could also prevent pregnancy?
Right. Lots of different causes of infertility. I found several things, such as a bicornate uterus, which means that in the embryonic stage of the woman, the two sides of the uterus didn't come together well, and so now you have two channels instead of one. So it's almost like half a womb on this side and half a womb on that side, and it's very hard for the baby to develop in those kind of situations. There's some fancy surgeries that we can do to repair that. Other things that can go wrong is blocked fallopian tubes. But most of the time when we talk about blockage of the passage of sperm, it's actually because of the lack of cervical fluid. So really that takes so much of our attention, that cervical fluid. And lo and behold, the woman is able to monitor that herself because that cervical fluid is evident at the opening of the vagina. She can see that, and she can follow along. As we're making progress with her ovary function, she's seeing the cervical fluid to get better. It's very exciting to them.
Is it, you take temperature or something?
Temperature is another sign of that ovulation has maybe taken place, but it's nowhere as valuable as the cervical fluid is.
I see. Now, how can it be that NPT pregnancy complication rate and embryo loss rate is much less than IVF?
So with the IVF situations, as we said, they're achieving pregnancy in glass, maybe analyzing the babies, and then taking the babies and putting them into the womb. Well, if there's something wrong with the womb, there's something wrong with the ovarian function, the hormonal levels, the possibly low-grade infections inside the womb, you're putting the babies back into a dangerous situation. And I haven't mentioned yet, but the immune system has a great deal to do with infertility, especially in those people with endometriosis. The endometriosis, it's hard to explain in a short time, but the immune system tries to attack the endometriosis, tries to get rid of it for the mom, but in the process it's attacking the lining of the uterus, which looks just like endometriosis. So there's an attack inside the womb going on, and here comes the IVF doctor with the babies to put inside there. And that's a hostile environment, and the babies might not survive as well. So in the naprotechnology world, we are trying to fix that before the babies get there. The babies are then able to have a better placentation, which means the placenta attaching to mom and growing and developing. It's one baby at a time. And by doing this, by healing the system, the pregnancy goes to full term. And you're not having babies born early, ending up in the neonatal intensive care unit, all kinds of IVs and breathing tubes and chance for neurological damage and damage to the lining of the intestines and so on. So it's much safer for the babies to have mom fixed first and then make myself present in the womb.
I see. So, and then I've heard that naprotechnology is used to women's health issues other than infertility. Could you give us an instance,
Sure.
say like a PMS?
Right, several instances. Premenstrual syndrome, PMS, is a very real thing. You know, a lot of doctors have been trained to say, oh, that's an emotional condition or anxiety condition. But no, it's got a lot to do with the ovarian hormones and the effect that they have on the neurotransmitters in the brain. So if you can help the ovarian hormones to be better, then the brain functions better. the woman is able to function more. I've had ladies describe, I feel like Dr. Jekyll and Mrs. Hyde. It's not me in that second half of my cycle. The hormones aren't where they need to be, therefore the neurotransmitters aren't where they need to be. The energy in the brain, the neurotransmitters are the chemicals that the brain uses. They depend on the ovary function to work well.
Mm-hmm. And what about, for instance, ovary cysts?
Yes, ovarian cysts is a major cause of surgery these days for women. It's a little bit similar to what tonsillectomies used to be when I was a kid. So oftentimes women will actually have endometriosis causing pain. They present to the emergency room does an ultrasound, and they say, oh my gosh, there's an ovarian cyst. Next thing they know, they're in the gynecologist's office, and he says, well, if it's still there next month, we can go in and get rid of it. Well, it's really the dysfunctions in the pituitary gland and the hypothalamus that lead to these ovarian cysts. What causes the hypothalamus to not function well? Oftentimes it's light in our environment. And look at the city of Boston. You know, you need darkening curtains to keep your bedroom dark. Mm-hmm. When there's light in the bedroom, the hypothalamus really gets confused by that. And the rhythms that are set up by the hypothalamus to the pituitary and then from the pituitary to the ovary are askew, and the ovary doesn't work well, starts to form cysts, and the next thing she knows, she might be in the operating room.
Can they remove cysts from the ovary?
They can, but it'd be much better if we could avert the problem that leads to the ovarian cysts. Now think about insurance companies. Insurance companies, it's very expensive if the baby's in the neonatal intensive care unit. It's very expensive if mom's in the operating room. So the insurance companies are starting to love this idea of restorative reproductive medicine and fix it. So it might take a little bit longer. I think of it like, what do you call it, a crock pot versus a microwave oven. Mm-hmm. All right, so the IVF center, microwave oven, you know, within one cycle, maybe two, hopefully we've achieved a pregnancy. It's only about, at best, a 30% chance of achieving a pregnancy, maybe a little bit more if you give it more cycles. But in the Napro technology world, it's more like a crock pot. Give us 6 months to try to help heal your body, mm-hmm. and then you'll achieve naturally in your own bedroom with your own partner and one baby at a time in a healthier system. So it takes on average for us about 6.4 months, but we have 60 to 80% success rates depending on the cause of the infertility.
Mm-hmm. And the age factor, you'd love to see. I know in this country we seem to have a bias against teenage pregnancies, mm-hmm. And yet when a girl is 17, 18, and 19, she can conceive.
Biologically, it could be the very best time. Mm-hmm.
And we've, our society, we've delayed with
yes.
A lot of things. And what are those break points for women as far as conceiving, age-wise, would you say?
Age-wise, the family doctors and gynecologists are in an unusual position. We see these women struggling to achieve a pregnancy, but then they'll be dealing with a 14-year-old who's pregnant. It's like, how can she get pregnant when she's not socially ready to? And then this lady who's 25 years old, has got her career lined up in their car, in their place, she can't achieve a pregnancy. So the landmarks, I don't have the exact numbers in my head, but in general, the older that you get, the harder it is to achieve a pregnancy. And after age 44, it's extremely hard. 42 to 44, quite hard. 40 to 42, we can probably accomplish it depending on the underlying disorders. Between 30 and 40, you've probably got about a 35% chance of not being able to achieve a pregnancy. Between 20 and 30, it's a pretty steep curve. From younger 20s, very easy to achieve, and older 20s, not quite so easy.
I see. Well, now, if folks wanted to find out more about Napro technology and also about various places where they could go, do you have any websites
Sure.
you could tell us about?
Sure. Simple, www.naprotechnology.com is a very good way to start, learn some information. That site is hosted by the Pope Paul VI Institute for the Study of Human Reproduction. That's the place where I was trained. It's not only for Catholics, though, even though it's Pope Paul VI. Pope Paul VI was the stimulus for this type of research to happen. He says, doctors and scientists, you can accomplish this. I know you can. And so it was named for him. There are 2 doctors in Massachusetts right now. Unfortunately, I'm not in practice to serve patients in Massachusetts as of a month ago. I'm going nationally to try to improve access to this type of care.
Mm-hmm. Well, Dr. Carpentier, we thank you very much for making the trip in today from Springfield. We really appreciate it. And we hope you are fans, listeners, people watching the show, get a lot out of this show. We hope you learned a lot and found it unique and informative, content-rich, truthful, and thought-provoking. Well, thanks for watching. I'm Brendan O'Connell, your friend for life. Very fortunate today to have Alex Schattenberg in-house. He is the international guru as far as euthanasia and fighting euthanasia across the world. He heads up, he's the international chairman of the Euthanasia Prevention Coalition.
Yes, yes.
Well, Alex, tell us, what is happening in the world today? Can you tell us some of the continents you've been on and that sort of thing?
Yeah, I think the first point is that in Massachusetts, the whole ballot question 2 is important, but that is assisted suicide.
Hello, welcome to Life Matters. I'm your host, Brendan O'Connell. Today we have perhaps the foremost authority on the doings of what Planned Parenthood is really up to and how they operate around the country, how they get into communities, into schools, into pretty much all facets of our lives. And some of the dichotomies that they have, where they have more and more abortions, yet fewer and fewer facilities. How does that work? And we're going to ask today's guest. He's the vice president of the American Life League here in America, based out of Virginia. Well, welcome, Mr. Jim Sedlak.
Well, hello, Brendan. It's great to be here.
Jim, let me ask you, first of all, how is it that Planned Parenthood facilities are closing, or clinics are closing, yet they're opening other ones and they're